today has been like pretty gosh, I just don't want to do this. You'd think by now it would be so easy for me to be vulnerable on camera, but I just feel like there are days like this where I just can't. Because I do not want to talk about it, and I'm so tired of talking about it. I had my first round of nerve testing done today, and it was with my EDS specialist, and we just did for body, like arms and hands and stuff, and this is this was EMG, so it's all large branch fiber nerves only, and she told me before we even scheduled it, and reiterated it today, that like even if it were to come back normal, it doesn't mean that the symptoms I'm feeling are not real. A lot of the time, with, if not all of the time, in EDS patients, when we get nerve damage symptoms, it's small fiber nerves, and I have to see a different doctor for that. That doctor's currently on maternity leave, so my appointment with her isn't until March. My EMG for upper body came back negative, so she was like, it looks good, but again, you know, we know with EDS, and a lot of what I've been through, normal doesn't mean that there's nothing there. Normal testing doesn't mean that your body is functioning normally. I go back to do my legs next week, but while I was there, she told me that she had talked to the general surgeon that I had seen probably a month or 2 months ago at this point. So that doctor, she originally referred me to him to check for compression syndromes, so MALS or SMA syndrome, and when I originally saw him, told him about my gastroparesis, and, you know, was just hoping he would take on that case. He was like 100%, like, you know, we'll talk about your options, basically. But first we did SMA and MALS testing, because specifically my surgical options, which is where we are, because I've tried all of the medication, I've tried the diets, I've tried all the different things before and after finding out that I have GP. So I had to he did an ultrasound in office, and he was like, it's a very slight, but it looks like you could have MALS, so let me send you to an actual facility where they're trained to do this imaging. So I went to Banner and got a CTA done. Results came back from the CTA. The report had said, you know, unremarkable findings, basically meaning they found nothing that the doctor ordered the scan for. I had an appointment with him. You know, we followed up on the imaging, and he basically said the same thing. He said everything looks good, it looks like you don't have any compression syndromes, and to me, to be completely frank, it was bittersweet, because although the process would have been slightly more complicated to have to treat both GP and a compression syndrome, or two, because there was a possibility that I had both, it was bitter, because that is usually like, you know, big green flags for them to start enteral nutrition. I haven't been able to eat well in months. I'm down to 92 pounds. I was 111 like during and before summer mission, and like I remember like probably mid-June or July just thinking like I just feel like I can tell there's already not a lot to me. I worked really hard to even get to 111 and be somewhat in a healthy weight, but I just remember like feeling when I was like not you know, eating enough, getting enough nutrients, all the things. So yeah, it's like no compression syndromes, which was, you know, a little bit of a bummer, and it felt as though like I would have to wait longer, I would have to push harder, I'd have to see more doctors. Because there were no compression syndromes, the first 3 lines of treatment options that he gave me were a G-palm, which is where they like slice a muscle in your pyloric sphincter so that it opens, and basically food, when it enters your stomach, it will just drop down to your intestines. My second option was a gastric stimulator, basically a pacemaker for your stomach. Even when he was telling me about it, I really wasn't sold on it. Went home, did more research. Definitely am not sold on it. There's just way too many factors that I have. Like, I have 3 autoimmune diseases, I have EDS, I have like all of these things going on, where I can't just make a split decision about one condition because it could be a snowball of problems. Those were my big 2 options. My third, almost not really third, is a complete GI reconstruction, where he like cuts parts of my stomach, parts of my intestine, and like removes small parts and then like reconfigures basically how my stomach is connected to my bowels. I remember asking him, how do I find out if my intestines are paralyzed? And I remember being pretty adamant about wanting to know those things before I even started treatment, because it just makes a big difference. I don't want to go through with a procedure that's, you know, gonna contradict another condition, another set of symptoms, if the value and benefit is not much greater than, you know, those side effects or whatever. He didn't completely tell me that he wasn't going to test, but I didn't get a definite yes, and it was very much just like we don't really need to do that. Like, why would you want to do that? Why would I want to know more about my body as you're telling me all of these horrible things that are going on in my body? I don't know. Why would I want to know that? So I told him, I said, I'm going to keep my appointment. I had an appointment that I had already scheduled with a GI specialist in Denver. Just the company overall. It wasn't a specific person that I wanted to see, just the company, because they, you know, their website promoted that they specialized in GP, specifically in enteral feeding and nutrition. From day one has been my biggest concern. So that appointment was 2 days before Christmas. That appointment was so freaking useless, and I was so irritated and upset and frustrated at what felt like time and resources wasted on that. They had scheduled me with a PA, and she was basically like, yeah, it looks like you've tried absolutely everything, but there is one last thing before we even consider surgery or maybe do further imaging. She prescribed me an antibiotic, erythromycin, told me to pick it up, take it for 30 days, in 30 days, check back in with her and see if it worked. If it didn't work, she wasn't promising anything else more than more testing and poking and all the things. There was actually a problem with my patient profile. They, when I got there, didn't have my name spelled correctly. They didn't have my email correct. Not sure how my insurance even went through, because I basically wasn't me. It wasn't me in the system. So when I got there, they had to create a new profile for me with all of the correct things. Well, the doctor sent the medication to the old profile. It never went through. 2 weeks went by before I could do anything about it. I couldn't message anyone on the portal because my patient profile was wrong, so I couldn't log into my portal to message anybody. Anyways, I ended up, instead of messaging her like, hey, can you send the medication in, because I was pretty certain I wasn't going to take it anyway. I can't risk it. I'm on 18 different medications the last time I counted, and I think I've added 2 since then. There are certain medications that I'm on that like cannot mix with an antibiotic. The antibiotic will either make the medication basically void in your system, to put it in layman terms, or elevate the amount of that medication in your bloodstream and just cause insane side effects. All of the side effects from erythromycin are things that I'm already experiencing. Why would I take that medication? So I sent her a message, and instead of saying, hey, can you send the medication back, I sent her a message and said, look, here's what happened. It's been 2 weeks. I can't afford to waste any time. I definitely can't afford to try anything else, as you know, anything else that's not, again, going to prove beneficial, anything that's going to waste time. I said I would like an enteral nutrition consult. She sent me a consult. I have that doctor scheduled for February 4th, but today, finding out that, I actually don't even know if I've already said this. I feel like I'm going on tangents, but at my nerve testing, my doctor said that she had talked to the general surgeon who I've been talking about, and he said, after telling me that there were no compression syndromes, she said that he told her that I actually do have SMA syndrome, and she said that I should call him back and schedule and talk about that just so I can have all my options. I just can't, I'm struggling on so many levels for so many reasons about this, because, it's just, yeah, I can't be anyone's guinea pig anymore. I do not have time. I'm literally wasting away. I sat on a call with you, trusting that as my doctor, as a medical practitioner, that you looked at the imaging that you ordered and ruled everything out, right? So I told you no to the gastric stimulator, the thing that and that's another reason that it was so off-putting for me, because I feel like he just kept pushing it and trying to sell it, and it made me feel like he has to be getting a commission or something from this. There's no way this is just because you think it's for my well-being. And if you look into it, gastric stimulators, they're not a cure for there's no cure for GP. It's not happening. And I have the most severe GP that you possibly can. And so a gastric stimulator is we do the surgery, we put it in, I have an awful time recovering, still can't eat throughout recovery, and this is all for the off chance that I might possibly be slightly less nauseous in a year after we play, with my system settings. And it's not something that I wouldn't have the remote to it. I would have to go in and see him every time that I need settings adjusted, so it's just not worth it to me. But I sat and listened to you reassure me that GP is the only thing going on. And then I have to basically hear it through the grapevine that I actually do have compression syndromes going on. So it feels weird. It feels a little fishy, because why did it take me basically putting you on hold? Because I told him I was going to go see Rocky Mountain Gastro. So I don't know if it's I just don't know if I trust it. Did you go fishing for it's not really SMA, but it's close enough, and I can say it's SMA so that I get this client back, because he is a private practice. I should add that. Feels like it helps in the American healthcare system. He's a private practice. So I'm waging these two wars between either you've gone around and fished for something and now you're lying to me, stressing me out about something that's actually not true just so that you can get more money out of me, or you didn't do your due diligence the first time and surgery could have been done. Like, we could have expedited this process. So, like, if that's the case, I'm also, like, really pissed off because, like, yeah, like, I trusted you, and, like, it feels like such a waste of time if you didn't do your job right the first time. And now, like, I've been sitting here getting worse and causing more issues because you didn't do what you were supposed to do. And, like, yeah, I could have saved time. Like, I could have not gone to Rocky Mountain. Yeah. Anyways, I just thought it was, like, really hard to hear today because not even because, like, that's what's, like, going on, not because I have the condition, like, if he is telling the truth, but because, like, yeah, I just feel like my quality of life is not valued to these people, and it just is, like, so frustrating and aggravating, and I feel so defeated. It's really hard to trust doctors, and it sucks. So, yeah, I called them back today, and I have an appointment with them tomorrow morning. And yeah, I just don't know, like, what to expect. And then it's scary because I've obviously been fighting so hard to, like, hurry up and get this stuff done and rolling, and yeah, like, if I talk to him tomorrow and he's like, you know, surgery next week, like, I don't know. On one hand, well, it's everything I've been wanting. I'm also so scared because there's just so much, like, I just have so much going on right now too, and I can't just, like, it's not like they're just going to take my appendix out and then I heal in 2 weeks and everything's fine. Like, this is, like, surgery and then time at the hospital, which means time off work and then time at home recovering, and yeah, I just need more information. It just feels so daunting. Like, it's not the surgery or anything that I'm afraid of, it's, like, the aftermath and rearranging my life around all of this. There's just so much happening. My doctor and I today also talked about me possibly having May-Turner syndrome, which is compression, but around your pelvis, and how unironically for me that as soon as I got home after that appointment, I, like, subluxed part of my lower back. It's literally just bending down, and yeah, so my back is killing me, my pelvis is shifted, my SI joint is screaming, and it just, my whole, like, anyways, so yeah, that's another referral. She's awesome, super sweet, and, like, very knowledgeable, but she was like, I know it's just another thing on your list, and you have a lot going on, but, you know, if you can and you feel up for it, I definitely think you should go talk to this doctor. And so, yeah. I don't know, it sucks because for the first couple years of being sick, I feel like all I begged for were diagnoses, because I just assumed that when you have a name to something, like, doctors will actually take you seriously, treat you with more urgency. And this last year, almost 2 years now, has taught me that even still, those things really don't matter. Like, being able to name something does not guarantee access to care, and it sucks. I'll have more answers tomorrow, and depending on how I feel tomorrow after my appointment and before work, I will give more updates. Sup, chat? It's been a day. I need to hurry up and sit down, but I just got back from doing lab work. I had to go to 2 different places because I requested lab work from my doctor, and a lot of it was basic, but there was one test that I wanted her to do that UC Health doesn't do. So she let me know that she would print the orders and I'd have to go to LabCorp. So I did my orders at UC Health, and that's just like my iron and vitamin D and all of the things that we were checking before. I'm now getting updates on. There were a couple, like, I think vitamin A and stuff like that that I haven't gotten before that I wanted to get, just in case it would be helpful when I see enteral nutrition in February. So went to UC Health, got the labs I could get. The other catch is I was gonna fast, but I went and looked at the notes and it said I didn't have to. So I ate a bowl of cereal, and she was like, for your vitamin E, vitamin A, and one more, they want you to be fasting. So I was like, okay, do the ones that I don't have to fast with, and I will go back and do the others. So I have to go back on Monday to get more blood drawn. And that's okay. I should have called and asked, and I didn't. So no big deal. Okay. But then I went to LabCorp and I did standing norepinephrine. So for the test, sorry, I'm like still just out of breath and dizzy. For the actual test, I had to lay down first for 5 minutes, and then he drew my blood while I was laying down, and then I lay down, and then he stands me up immediately, like no transition, no like, oh my gosh, my brain fog has also been insane. He stands me up, no transition. With POTS, a lot of the time, like I have to sit up first. Like if I'm laying flat anywhere, my back, my stomach, whatever, I have to sit up first for a little bit and then get up. Either way, I get dizzy, but it's worse when you just like jump up. That's basically what I had to do. And then I had to wait a few seconds for when my symptoms got bad, basically until I was on the brink of passing out, and then tell him. It only took me, he said 15 to 30 seconds, and then he draws my blood standing up. And yeah, it was just crazy. I almost passed out. He was like, scale of 1 to 10, like how close are you? And I was like 8 to 9. I'm like sitting there trying to, he was like, keep your eyes open, it helps. But I'm sitting there and like my vision is like blurry. It's still just now coming back and all of the things. Anyways, so because I had such an awful reaction, I was at LabCorp for probably like 40 minutes. But I will say that both of the techs were super, super kind, super patient. The main guy that like did
most of my stuff. Yeah, he was like an older guy, and he had said toward the end that he has kids my age, and he just kept saying, take as long as you need. Like, this, you know, this is your time. Like, we're not, you know, we're not in a rush. Just take your time. And he was just so kind and patient and gentle. And he was like, yeah, I have kids your age, and yeah, I would just be so upset if someone like just pushed you out and like didn't care. And I was like, I just really appreciate that, because, and I told him, I was like, unfortunately, like, that's the norm, is just like the healthcare system is just like, let's get you in and get you out, and you know, and not in a way necessarily that they have a sense of urgency about your care, but about how many people they can get, like how efficient they can be, how much money they can make, how, you know, and you feel it. So it was just so awesome to have such a great experience and to have such patient people. So that was a win for today, even though I got stuck 3 times for 3 different blood draws. It was worth it to have data about my body. Some of my labs have already come back, no longer have vitamin D toxicity, which is great. My iron still sucks, which I'm not surprised. And something else came back. I don't remember. Oh, my magnesium. I was magnesium deficient before. And even though I haven't been able to take as many of my magnesium pills lately, I'm still right. Like, I am like 1 point in the green. Anyways, yeah, I'm still so dizzy. I have to log into work in 30 minutes, which is good. It's time. I'm trying to think of any more updates. Let me just read you off all of the things that I've done this week for my health. Like, as far as appointments, this week is insane. Next week is in the middle of insane and chill. Monday I had PT, no therapy, which is actually nice to have a break from that because I had a lot to do. Tuesday I did my first EMG. I have my second EMG next Tuesday. That's for my legs and feet. I told you guys I talked to the general surgeon that I was originally talking to. I still don't even really want to talk about that, but the key thing was feeding tubes are next, which I've known that for months. I've just been waiting. Sometimes when it comes to doctors, like, you have to let them think it's their idea. You have to wait until they come up with the idea, and you'd be like, oh, really? Okay, sounds good. And you're like, you idiot. He's waiting to put the order in until I see enteral nutrition, February 4th. If enteral nutrition agrees with it, he'll put the order in. Unless enteral nutrition wants to put the order in. Regardless, it's not either of those surgeons doing the procedure, because I'd be getting an NJ tube first. So it's a radiologist appointment. Yesterday I did allergy shots, 12 shots. What a G. Still feeling it. Have you ever had cotton mouth? It's like cotton throat. We did dog, cat, and I'm assuming horse yesterday because there was 3 vials. And yeah, I didn't even know what was in the vials. They just kept saying your formula. I'm like, okay. But I always, yeah, when it comes to the animal allergies, I always get that like cotton throat. And like, anyways, I feel like I'm so scatterbrained. Hopefully I can get one of these finished without lagging. I needed my phone because I want to read these test results. But to finish what I was saying, allergy shots on Thursday, 12 shots total. 12 shots total, 4 rounds of 3 in the back of my arm. And they're actually fine. I haven't checked for bruises. She just kept saying, I'm afraid I'm going to bruise you. I gotta do what I gotta do, babe. Monday, I go back and do the rest of the blood work I was supposed to do, 3 vials, because I didn't fast this morning. So I'm going to get allergy shots again on Monday. 12 shots still. I think my serum will be a little bit thicker, whatever that means. After that, because I'll be so close
to the lab. I'm just gonna go get blood work right after that, and then hopefully come home and nap. And then at 3 I have therapy. Tuesday I have my second EMG. Then I have PT. Then I see the pain clinic. Luckily PT and pain clinic are in the same building, which was good. And then I have my PCP at 3, but that's telehealth, so that's good. Wednesday I have to go to Denver to see my psychiatrist because the only way she legally can keep prescribing me Ambien is she has to see me in person, and she's only seen me telehealth. So joyride to Denver Wednesday at like 6:30 in the morning because my appointment's at 9. Why I did that to myself, I don't know. Therapy on Thursday, PT on Friday, and then nothing. And mind you, obviously I have like work in between these things. I've got like internship stuff to do. Sundays are full. Week after, allergy shots, therapy on Monday. Tuesday's good. Wednesday I have my surge consult. We're in February now. I have my telehealth appointment with my endometriosis specialist. I did schedule that surgery. It's in April. How exciting. Then I have an allergy appointment that same day, later in the day. This is just like a regular office visit that I had scheduled. Yeah, we'll probably talk about drugs. Week of February 9th, allergy shots and therapy on Monday. Rheumatologist on Wednesday, an MRI before my endo surgery. That's also Wednesday. Therapy on Thursday. Looks like I'm off the hook for the rest of the week. Let's pray it stays that way. Anyways, my test. Okay. What is it? Hello?
Your lab results showed that your blood sugar was a bit low this morning with your lab draw. Did you eat anything before you did that draw?
I did. I had cereal.
Okay. And have you eaten anything since then?
No.
Okay. So Dr. Richard's out of the office, but one of our other nurse practitioners here in the office had recommended that you eat something with sugar, protein, and healthy fat. Like she recommended like peanut butter and jelly sandwich or something similar to that.
Okay. To like do another draw?
Let me check with them and see if they want you to do another draw or not, but for now, they said just to give you a call to let you know, that you should probably eat something else, and, just to see what you'd already eaten this morning. So, take care. Bye-bye.
Bye. Well, that's also probably why my standing, was so awful, and why I had such a bad POTS episode. That's great. Okay, well, here's the thing, too. I feel like this is why it's important to read a patient's chart and to be training people how to work around things. What I'm trying to say is I have gastroparesis, like I've said 100 times. It's in my chart. It should be everywhere. So when she asked me this morning if I was fasting, I said no, but I had only eaten 30 minutes prior to getting there. My gastric emptying is so delayed that like stuff will stay in my stomach for 6 hours. So as far as like my intestines and nutrients and everything like absorbing, I ate 30 minutes ago, but I don't have the average digestive system, so it doesn't mean as much. Anyways, do you got what I'm trying to say? Because I don't. Anyways, okay, well, I'm gonna go have Milky Ways and just sit here, and I've got candy. Actually, this is a great excuse. It's 11:45 in the morning, to be clear. Okay. That's funny she said that. I didn't realize I was literally looking at that. This is just my BMP. So my sodium's fine, potassium's fine. Good, because I started taking. And I'm only a few short of being below normal. I just started taking potassium supplements. My chloride's fine. My carbon dioxide is a little concerning. Anion is fine. Glucose is low. My BUN is super high. I don't think I'm at 24. I'm like almost
off the scale. I forget what BUN tells you. My tummy's gonna hurt so bad. A waste product from protein breakdown in your blood, indicating how well your kidneys filter waste. I need the ones about my liver to come back. I think that's this. My ferritin serum is good. Let me view trends because I think it was too high last time. So that's gone down, which is good, which means my liver is holding on. Well, great. Cool. So that's the update. Can't believe you told me to eat a peanut butter and jelly sandwich. What? I'm gonna be so irritated to edit this vlog later because I just have been like the word vomit queen lately.